Just can I ask, in terms of your point they make that support is needed to increase opportunities for children to be reunited with families, what's the nature of that support? Is it social work support? Is it
could be social work or social care. For example, in your own county, the Family Support Services, I was visiting them a couple of weeks ago, and I was asking, are they mainly involved with early intervention, prevention of problems in the community? And they were assuring me that no, that they're involved. They run a kind of an emergency service. So if a placement is breaking down, for example, where, maybe a young person who has been quite settled in a placement hits teenage years, or a number of things are going on, the support can be varied. I mean, in the group that I was talking to, we had everything from, a social care worker driving a child to school every morning. They generally roll up their sleeves and do what's needed to support. And in the reunification, many children we find do go back to original families where that's at all possible, and rather than leaving them to their own devices and only providing support to residential care staff, there is a commitment to provide to the families of origin as well.
And just on that issue of the availability of social work teams and social workers, in terms of the numbers of referrals last year and the initial triaging of those referrals, any idea what proportion might not have been afforded a social worker?
Good question, to which I don't have the exact answer to, Deputy Connolly. I'm not sure if you can assist.
Yeah, so we'd over 106,000 referrals last year, which was a 10% increase. And just to say, we already see this year now in Q1 another 10% increase in referrals. A really important part of the reform programme that we are undertaking at the moment is, up until December 2025, every referral had to come through a social work initial assessment or screening. And, for many families who just wanted family support, early intervention, they did not need the intervention of a social worker or a child protection system. So a huge part of our reform is now the introduction of, first of all, a new portal for referrals. So people in your community today can now refer for a family support service and don't have to go through a child protection service. And also it means that every child is now being screened by a multidisciplinary team, so that if they need, and if their needs are more appropriate to family support or early intervention, they can be supported in that way much sooner, much earlier than having to need a child protection service. And what that's doing is, first of all, it's obviously allowing kind of timelier access to the most appropriate service for young people, but it's also making sure that we're using our social work professional resource in the way that it is needed to be used, in terms of making sure that all of those children who need a social worker in terms of child protection have a social worker allocated.
That's a very in-depth answer. I'll have to reflect on it maybe at some point, but just in terms of the numbers that haven't gone through that initial...
Yeah, so at the moment 72% of our cases are allocated to a social worker. Okay. And what we're hoping with the reform is that that'll go up to 100%, because we now have social workers not having to do work that is better left to a family support worker or a social care worker.
I just asked Ms Clarke, I realise that the time goes very quickly, and I have questions for the AAI as well, but just any comment on the educational provision within the alternative care locations?
I can't comment just yet, other than in the special care units. I've been to the 3 special care units, and indeed twice to one of them, and I've been in the schools, which are well provided for and full of very dedicated people. But in the general residential care, I've just been to the accommodation side since I started in February, so I can't particularly comment.
Thank you.
Thank you for watching. Please like and share.